talk about a canine atopic dermatitis, it's definitely one of the most common reasons that any client is going to bring their pet to see a veterinarian. Managing the disease, it can often be frustrating because we see many different clinical presentations, whether it be otitis, maybe it's an acrolick, maybe the dog is causing a lot of self-trauma, or it's getting a lot of secondary infections, whether that be pyoderma or malassezia dermatitis. And then we see this vary from breed to breed to breed. And so it's never looking the same way as it comes in from case to case. When those dogs come in, there's several components contributing to the symptoms that they're seeing. And we have to address that infection. We have to address that underlying inflammation and itch. And if we don't address both of those, that's where we can see some problems or potentially some treatment failures. Studies have shown that clients feel their dogs are uncomfortable, they lose sleep, they don't want to play as much. Additionally, we see some behavior changes. There's some great studies looking at that in terms of the dogs might become more aggressive. Maybe they're more touch sensitive. Maybe they're just more anxious in general. We know from studies that half of clients feel their own quality of life is impacted by their dog's disease. And not only that, but almost half of clients with a dog with canine atopic dermatitis also feel their quality of life is diminished because of what it costs to manage or keep that patient really under control. Our clients are trying to tell us close enough is not really good enough for them. They really want to see their pet getting back to a state of normalcy. Zenrelia, ilunocitinib tablets, is a Janase kinase inhibitor. It's a once-a-day medication with no loading dose. It can be given with or without food, and it's labeled for the treatment of dogs with allergic dermatitis or canine atopic dermatitis 12 months of age or older. Zenrelia, when used at labeled doses, is incredibly effective and safe, with GI upset and decreased appetite being the most commonly encountered adverse event with the medication. Zenrelia specifically has a warning label around vaccines and the timing of vaccines in concordance with administration of the medication. That warning label comes about because of a primary vaccine study that was done in a small group of dogs at 3 times the labeled dose of the medication. We are hearing story after story of just the great amount of efficacy that we're seeing with the medication of, again, getting these dogs back to normal itch levels or normal clinical scores with their disease. What's really been exciting for me as a dermatologist is to see some of these patients that I have struggled with for a great deal of time on a single medication that can potentially get dogs more normal days is really what our clients are wanting, and is what we want to deliver as veterinarians as well. We want to minimize those number of urgent clinic calls that those clients are having to make, or the number of days where they're having to watch their dog itch, wishing they could potentially do better. For those veterinarians wanting to learn more about Zenrelia, they can go to zenreliaforvets.com. At that website, they can find the various studies that I've been discussing and talking about here. They can also learn more about trying to reach that state of Zen for their clients.